Hi everyone, today our video is about the nursing diagnosis in a mental health nursing. So how we need to frame the nursing diagnosis in a psychiatric cases. Okay, so first nursing diagnosis is chronic low self-esteem related to disturbed body image, fear of rejection, ineffective communication skills and domestic abuse. So chronic low self-esteem can be related to disturbed body image, fear of rejection, ineffective communication skills, domestic abuse. It can be evidenced by depressive symptoms, hopelessness, insomnia, reduced eye contact, self negative verbalization. Okay, so here is the outcome for this particular nursing diagnosis that will be the patient will demonstrate the behavior of improved self esteem, such as eye contact, appropriate physical appearance. So, here we have written uh, the evidence, right, like a symptoms of patient. So, reduced eye contact. Okay, so we need to improve the eye contact of the patient with the nurse, and here also related we have written on disturbed body image, so that also we need to improve. So we need to improve the body image of the patient. So for that, here we have written the outcome, that is appropriate physical appearance. Okay, so here are the interventions for a particular outcome. So first one is assess the patient's past and current achievements. So first thing in an intervention we need to do is assessment, right, about the patient and patient behavior and patient symptoms we need to assess first. So in that first assessment of the patient past and current achievements. Next, assess how the patient views themselves. That means appearance, how the patient views themselves. Okay, assess support systems. Okay, and assess for suicidal ideation. If the patient is having any suicidal ideation or a thoughts, that also we need to assess. And focus on what can be controlled. So whatever things we can control, so about that all particular topics we need to have a focus. And apply active listening and open ended question. So we need to ask the patient open ended questions, and we need to apply for active listening for the patient. Next, provide positive feedback and reinforcement of the client. Okay, so we need to provide positive feedback for a questions. So whatever we have asked the patient, so that answers from the patients, so for that answering we need to provide a positive feedback for the patient. Next, teach the patient to recognize and shut down negative self talk. So we need to teach the patient about recognition and shut down the negative self talk. So whatever talks the patient is communicating about himself, about negative thoughts. Okay, so that all the thoughts, negative thoughts we need to avoid. Okay, so these are the interventions for a particular nursing diagnosis, that is a chronic low self esteem. Okay, by these interventions we can achieve the outcome for this nursing diagnosis. Okay, and next nursing diagnosis is disturbed thought process. There will be disturbance of thought process of the patient. It is related to altered self concept, cognitive dysfunction, low self esteem, anxiety, fear and social isolation. Okay, so disturbed thought process related to altered self concept, cognitive dysfunction, low self esteem, anxiety, fear and social isolation. And next, it can be evidenced by absence of eye contact, decreased willingness, inappropriate social behavior, speech abnormalities, hallucinations, or delusions. So these are all the symptoms what we can observe from the patient. Okay, so here is the outcome for a disturbed thought process. That is, the patient will recognize and implement strategies to manage the hallucinations and delusions. Okay, the patient will recognize and implement strategies to manage hallucinations and delusions. So this is the outcome for the disturbed thought process. So here are the interventions. So what we need to do for a patient. So assess the patient's past medical history and identify factors present. So we need to assess for a past medical history and identify the factors present. So what are the factors now the patient is having, that factors also we need to assess. And next, assess and review laboratory values. So patient laboratory values. So is there any abnormality of the patient? So that can be seen in a laboratory test. Okay, that values also we need to assess. Assess the patient's cognitive ability. And next, reorient the patient to person, place, and time as necessary. So we need to repeat the patient about the questions like person, place, and time. So person identification, place identification, and time identification. Okay, so these are all the things we need to repeat for the patient. Next, provide safety measures as needed. Maintain quiet and calm environment and teach how to stop negative thinking. So we need to educate the patient to stop negative thinking of the patient. Okay, next nursing diagnosis is ineffective coping related to inadequate sense of control, inadequate social support, inadequate resources. Next, ineffective tension release strategies. And next, it can be evidenced by altered attention, altered communication pattern, destructive behaviors, inability to ask for help, inadequate problem solving skills, and substance abuse. Okay, and next, here is the outcome. The patient will verbalize the confidence in dealing with psychosocial issues. So this is the outcome for the ineffective coping. So what is it? The patient will verbalize the confidence in dealing with psychosocial issues. So here the patient will be going to gain the knowledge and the confidence to deal with the psychosocial issues. Okay, so here are the interventions. First, we need to assess the history of the coping, assess for possible causes of ineffective coping, establish trust and a therapeutic relationship with the patient. And next thing is assess the patient in setting realistic goals. And next thing is allow the patient to express their fears, feelings, concerns, and expectations. And next, support relaxation and leisure activities, encourage therapy and counseling. So these are all the interventions for the diagnosis of ineffective coping. Okay, and like this you need to frame the nursing diagnosis. Okay, and here are still more nursing diagnosis I have framed here. So fourth one is risk for violence related to delusions and hallucinations, impaired social interactions related to difficulty in forming or maintaining relationships. Next, self care deficit related to inability to perform daily self-care activities. Next, risk for self-harm related to expressed social suicidal ideation. Next, disturbed sleep pattern related to insomnia and hypersomnia. Next, hopelessness related to chronic sadness, and imbalance in nutrition less than body requirement related to decreased appetite. And here you can also add the anxiety related to treatment or whatever it can be. Okay, and one more thing is knowledge deficit. Knowledge deficit related to treatment or psychological therapies. Okay, as evidenced by repeatedly asking questions or it whatever it may be. Okay, so this also you can add in a nursing diagnosis. I hope we all understood. Thank you.